Today we are exploring chlamydial infection caused by Chlamydia trachomatis. Stay tuned to learn more and hit subscribe, and let's uncover what chlamydia is. Chlamydia trachomatis is a kind of bacteria. It is more common than gonorrhea in causing STIs or STDs in developed countries. Chlamydia takes longer, 6 to 14 days to show symptoms, which we call incubation period, than gonorrhea, which usually shows up within 3 to 7 days after infection. These germs target the linings of the genital and urinary areas, staying mostly on the surface. Since they don't go deep, you might not notice any symptoms. The infection usually stays in the urethra, Bartholin's gland, and cervix. In some cases, it can move up, causing a severe pelvic infection. Surprisingly, it teams up with gonorrhea, which we have talked about in other videos. If you haven't seen my video where I talk about gonorrhea, please just scroll down along my video, you'll find it. So most people with this infection don't show specific symptoms and might not feel anything. But if they do, it could be pain during urination or sex and bleeding after sex or between periods. Doctors might notice things like weird discharge, swollen cervix, changes in cervix tissue, and fragility. Complications of this infection include pain during urination and pus-like discharge from Bartholin's glands. If the infection spreads upwards, it can lead to inflammation of the uterus, which is endometritis, and fallopian tubes. Interestingly, most people with salpingitis don't show symptoms. However, it can cause scarring in the tubes, leading to infertility and ectopic pregnancy. This infection is a more common cause of perihepatitis than gonorrhea. The spread to the liver from the pelvic organs happens through lymphatics and the peritoneal cavity. To figure out if you have this infection, they usually collect samples from the urethra or endocervical canals. Testing chlamydia DNA using PCR is highly accurate, which is 95% actually, and using the first urine of the day is the best. Another method is using an ELSA test to find chlamydia parts, but it's not as accurate. You can also grow chlamydia in a lab, but it's costly and takes a while. If you are diagnosed, the doctor might prescribe antibiotics like azithromycin, ofloxacin, doxycycline. It's crucial for your partner to get treated too. If treatment doesn't work, it might be because you didn't follow the instructions or got infected again. If you suspect anything or have concerns, don't hesitate to reach out to a healthcare professional. So stay informed, take care of yourself, and don't forget to hit the subscribe button for more essential health insights. Until next time, stay healthy and stay informed.